We have a huge shortage of nursing staff, of physicians, and that is creating problems throughout the entire system.
Florida's prison system pushed to the brink, struggling to staff healthcare workers with high turnover and high risk.
But ultimately, it ends in massive lawsuits.
At 5:30, we showed you what's at stake with a shortage of correctional officers at an all-time high. Tonight, how the crisis in corrections doesn't stop at officers, impacting prisons' contracted medical staff.
Here is unpredictable, is volatile, is dangerous, is violent.
And all new tonight, I-Team investigator Kylie McGivern found the state does not track staffing for corrections healthcare workers. She shows us why a recently retired prisoner says it's a problem with consequences too big to ignore.
I'm RN with 20 years of experience, mostly hospitals. I worked for 4.5, 5 years at Zephyr Hills Prison. That was my first contact with prison.
What was that like going through those gates for the first time and entering that world?
Everyone who passes that gates and barbed wire, I believe, chills go through the spine. What I'm gonna find out on the other side. The psych being one of the places which is very volatile and where things happen.
Things happen.
It's highly unpredictable.
And why Greg Krolikowski says low staffing can create a dangerous situation.
It might be cutting, it might be violence, it might be open wounds, it might be attempt of suicide. I had roughly 40 inmates and I was by myself. 12-hour shift at night. People were calling in sick because they didn't want to work there with that kind of staffing. That revolving door, it costs money.
Money the Department of Corrections was supposed to save, outsourcing health care for prisoners in 2011.
If we can't find nurses to work in our hospitals, it's 10 times worse to work in our prisons.
Republican State Senator Jeff Brandes of St. Pete vice chairs the Criminal Justice Committee.
We have a huge shortage of nursing staff, of physicians, and that is creating problems throughout the entire system, especially when the state has a responsibility to provide health care for these individuals.
What are the ramifications of not having enough nurses in a state prison?
They can range from poor healthcare outcomes, sicker population of inmates, but ultimately it ends in massive lawsuits. And that's the thing that the state has now been fighting for years, is the lawsuits on negligent care.
Lawsuits that forced the Department of Corrections to spend another $146 million over 4 years to fund hundreds of new staff positions related to mental health and care for inmates with disabilities, as well as hernia and hepatitis C treatments.
We have to have a better system.
In 2018, the state contracted prison health care services to Centurion, a Virginia-based company and the only bidder for the $375 million contract. Problems in keeping healthcare staff positions filled was a significant factor in turning to privatized care in the first place. That's according to an independent audit of the Florida Department of Corrections inmate health care from 2019. That said, vendor performance in filling positions has been similar to that experienced by the state, and it still has difficulty in recruiting and retaining nursing and mental health staff. But the I-Team uncovered the Department of Corrections does not track Centurion's staffing levels as a part of its contract, only outcomes, something auditors called unique. Most contracts include detailed staffing plans to monitor vacancies. The state's contract with Centurion does not. Auditors write the impact of staffing levels on services is so significant that it arguably should be tracked and the vendor held accountable, and points to lawsuits that have cost Florida taxpayers millions.
We are not providing the medical care that so many of our people need.
Democratic State Rep Diane Hart of Tampa says Centurion has to go.
Going into the various facilities and speaking to the wardens and to the correctional officers, everybody says the same thing. We have no real medical provider. They're not providing medication as they should. Sick times are far too long. I mean, they did a study. It's in writing. And we're still allowing them to be responsible for our inmates.
According to that study, the state could save an estimated $46 million if it did not outsource prison health care. but it would continue to be difficult to recruit and retain staff. Centurion declined to answer questions about how many open positions it has in Florida prisons, but says it uses incentives and more than 30 recruiters to attract staff so that it can continue to ensure that high-quality health care services are delivered. 6 months ago, Krolikowski exited the prison gates for the last time, retiring. A casualty in a line of nurses he says could not go on.
It takes toll on everybody. If something's wrong, you should not just ignore it. I want to talk about it, hoping that things will change.
Change that could come from the state legislature when Centurion's contract ends in June. I'm I-Team investigator Kylie McGivern, taking action for you.